Hey, this is Pastor Curry, pastor of the Ye Zion Fair Baptist Church, Wilmington's most exciting church, the church that love ya. Ain't anything you can do about it. Today with Coffee with Curry, we wanted to just take some time out and say that we are very grateful for what God has done in the city of Wilmington. We have 3 Black women who could have gone anywhere, done many things, and probably have already done many things, who decided, I want to make a difference in the Wilmington community. And I'm very grateful to God for them. During the pandemic, they decided, you know what, we need to make a difference in the lives of those who really can't give back to us to the level that maybe they would desire to. We have 3 physicians who have some services that's going to really, really help. And I don't know whether or not you heard about them, but it's DHEC, and it stands for Delaware Health Equity Coalition, and reason why I had to turn the page because I heard the DHEC, and that was a kind of catchphrase, and I wanted to make sure I shared exactly what it is. But we're going to really talk about what they offer, how, whether or not you are insured or uninsured or underinsured, how they can still be a blessing to you. Why don't you call somebody real quickly? Tell them Coffee with Curry is on, and let's get after it.
Good morning, Delaware and surrounding areas. You are now tuned in to this week's Coffee with Curry. Join us every Sunday at 11 a.m. with new guests every week. So grab your cup of coffee and join us on Coffee with Curry.
And we're back. Well, it is really my pleasure and my honor to welcome to the Coffee with Curry, Miss Velma Scantlebury, who really, you know, as I was doing my intro, I'm just floored. I'm amazed with the level. I've read your bio. I've read your all 3 of you are just outstanding physicians, and in your own rights. But to really become selfless to help a community such as the community that y'all are really targeting is just unbelievable. First, welcome to the Coffee with Curry show.
Thank you. I'm honored to be here.
Yeah, and it's a pleasure to have you here. Before we get started, Ms. Scantlebury, Dr. Scantlebury, could you help me to, and the viewing audience, know a little bit about your background and what you have involved yourself in?
Well, thank you so much. My background is that I was born in Barbados, and my family immigrated to Brooklyn, New York, and I went to school there. I went to college, medical school at Columbia University, and was inspired to do surgery, which was very rough back then. And I was told that I couldn't really be a surgeon because I didn't have what it takes. And so my determination to prove them wrong continued to push me on. And I ended up finishing general surgery at Harlem Hospital in New York City and was inspired to become a pediatric surgeon. But in order to become a pediatric surgeon, I had to do research. And my research I was in the right place at the right time and was able to do some research in transplantation surgery. So that led me to University of Pittsburgh, which was the mecca for transplantation at that time. And so I ended up being swayed into transplant surgery. So I became a transplant surgeon and became the first Black female transplant surgeon in the United States. Yes. And so that was, for me, just pure, I love this field. It's exciting. I can save lives. And really looking at the disparities early on and seeing, especially for kidney disease, the number of African Americans on dialysis disproportionate to the population. So we make up 12% of the population, and we're always somewhere between. 20 years ago, it might have been 25% of the patients on the waiting list were African American. Now it's over 33%. So even though we're a small segment of the population, we are greatly afflicted by end-stage kidney disease, and that's primarily diabetes and hypertension. So that has been my career, Pittsburgh to Mobile, Alabama, and back to Delaware, where I finally retired from Christiana Care right after or during the pandemic in 2021, right afterwards. And that for me was a phase where I began to then get involved in COVID and was helping out because we couldn't travel outside the state. I was helping virtually in terms of Philadelphia Black Doctors Organization Consortium, helping them with getting patients registered for COVID vaccine, getting tested really early on. And at that point, we saw that Wilmington had issues in getting our African Americans out to get tested, get vaccinated. And the city called on some of the Black doctors from the National Medical Association to come out and help bring the numbers of, have that trusted aspect in terms of our community to get more African Americans and Hispanics tested and vaccinated. And so that's how we came together. Dr. Teal, myself, Dr. Marshall Lee, as well as Dr. Teal. And in those conversations, when we went from places to do these vaccines, there was a 15-minute period. You had to observe you get your vaccine, sit and wait. And there were so many conversations with the patients about why can't we be their physicians? They need physicians who care. And many talked about how they felt disrespected by their physicians. They were not being heard. They were dismissed. Their complaints were dismissed. And so they felt like the care they really wanted was not being delivered. And so we said, well, why, at that point, Dr. Teal was at Christiana Care, but she was ready to transition. I had left Christiana Care. I had left Christiana Care from transplant, retired from that. And it was like, okay, this is an opportunity for us to do something different, to bring care in a way that's compassionate, that's comprehensive, that's culturally appropriate, in a sense of being able to deliver that trust. And our slogan is restoring trust in healthcare, because we want people to be able to trust their physicians in order to open it. And once you have that trust, you have a better opportunity to care for patients because they can. And so that's how we got started. So we struggled in the beginning somewhat in terms of getting grant funded, having people believe in us, finding a place to get started. We incorporated, so we're a nonprofit, and we survive on grants, but we actually had a few that believed in us at the beginning and gave us enough money to open our doors, and that's how we got started.
And you opened your doors right here in Wilmington.
We chose 19802 because the health disparities in 19802 and 19801 are the greatest when it comes to, even though when you look at the data, there are many healthcare facilities within the vicinity, but yet still the disparities when it comes to longevity, health, diabetes, hypertension, heart disease, the disparities are significant.
I think that the people truly, and I'm glad you all heard, they have shared the truth. All too often, especially those who live in poverty, they're not heard.
Right.
They're told this is your issue, and they get over medicated, and it creates other problems. To have a doctor who cares, people can recognize that quickly. Bedside manners is something that I thought a while back. I was speaking with my wife. It's just not something people have, or doctors, some doctors just don't have anymore. And for people to really identify that, that means you all were listening, because I hear it often as a pastor here in Wilmington. I hear them talking about, my doctor told me I had this, then they found out that what they gave me was too strong, and then now their kidneys are failing and things of that nature. To have this is very key. Before I go too far, I want to talk a little bit about Dr. Teal too, because there are three of you right now. You have Coker, you have Teal, and yourself, and all three of you are just beyond qualified. I mean, it's not like you all were looking for a job. I mean, you have really luxury, not luxury, but wonderful careers. Let's talk a little bit about Teal first, and then I want to also talk about Dr. Coker as well.
Yes, Dr. Teal was at Elton Hospital. She was the CEO there and had her own practice for, I said, 19 years. And then Christiana Care took over Elton Hospital. And so she transitioned over to the Newark campus to be in charge of the family practice, family medicine, outpatient clinics. and was there for a short time, but then decided that she needed something different in terms of care delivery. And that's the vision in terms of our vision in terms of the way we want healthcare to be is not really the way the system is.
Right.
And so it's really about how can we change. If you can't change the system, then you make your own.
Amen. Amen. Amen.
So the goal was really to come together because she had a vision, and she's our CEO, in terms of, yes, we want to have a different way of delivering healthcare. We want it not necessarily to be based on fee-for-service. It's going to be value-based. And so it's really going to be about improving the lives of patients. And so what we do is really, when we have a new patient, is we have them fill out or tell us, what are the barriers to health? Do they have trouble with transportation? Do they have trouble affording their medication? Do they have mental health issues? Are they depressed? What's keeping you from wellness? And so part of our strategy is that when we look at health inequities, it's not treating everyone the same. That's health equity. Health equality is that everyone gets the same equal delivery. But health equity is really about providing the patient with what they need, because they may not be at the same starting point.
Right.
So their level, what their barriers may be greater. They may, like for instance, if we're all looking over a fence and you're 6 foot tall, you can see over that fence without any addition. But if you're 3 feet, then you can't give everybody a 2 foot stool, because some people will still not be able to see over that. So when we think about health equity is really about treating each person individually, identifying their needs, and providing them with the resources they need to be able to get to wellness and eliminating those barriers. And so that's one of our goals in terms of being able to treat each patient in a different way. And because your needs are not his needs and they're not my needs. And so that's the difference.
Wow. I think that's beyond awesome, especially for Dr. Till as well as yourself. And we have one more doctor, Dr. Coker, who is a household name in our community for giving to the community.
Absolutely.
Trying to find ways. She's an outstanding ear, nose, and throat doctor. I've heard many speak of her, and I know her personally. She's just a giant.
Absolutely.
But tell us a little bit about her too, because I want to make sure I have enough. So people, the whole goal, Dr. Scantlebury, for right now with me, is I want people to see the strength, the character, the fidelity of the people who opened up this nonprofit to help. We, in our community, sometimes we have a little skepticism when we see something this good. We don't believe it's real. Or maybe you're on the run from some other place and it's like you stop by. But it is just, I'm just floored. I'm floored with the level of skill set that the three of you women brought to the table and is producing. And we're going to get into all that later on. But just for a second, if you give us a little bit about Dr.
Dr. Coker
as well.
Well, like she said, she is a pillar of this community. She's well known. Her mother is well known.
Yes.
And as an ENT physician, one of the things that she encounters is many of her patients did not have a primary. And so it was important for her to be able to say, I am treating you for ENT, but I don't want to treat you for high blood pressure and take care of your cholesterol because you trust me and cannot find someone else to go to. So here's an opportunity for you to, so what she does is she refers her patients from her ENT office to us who need primaries because she's had so many of those. She actually still is part of ENT, Delaware Allergy and Immunology, but she would have a time in our office on specific days so that she will eventually be able to practice her own practice for ENT out of our office for her patients. So that's the goal down the line.
Excellent. This is wonderful. Now, one of the missions of you all is to provide compassionate care. Where was that? Why was that birthed?
It really was birthed because of in those conversations during COVID, the fact that people felt that they need doctors who can listen who can be empathetic and really hear them and have compassion, understand where they came from. And if you don't understand where you're coming from, then you don't see the obstacles in the way. And so if you're in an emergency room and you have, you're being dismissed and you're given these things, here's some medication, go see your pulmonologist, go see your primary care. But nobody has taken the time to say, can you afford these medications? How are you going to get to, do you have transportation to get to the specialist? I've seen a patient being discharged home who's unable to walk, bedbound, and that's sort of given all these appointments to follow up in 1 or 2 days. And no one makes arrangements to get this patient out of their house to. And
even though most hospitals have the social service there, but still it does not happen unless you have that extra money or big time insurance.
But it's not, you're not recognizing the barriers to getting that patient have, getting out the house. And that was what the daughter said. How is she supposed to get to the doctors? You know, that's a different, you have to arrange for that to happen.
And I appreciate it. And it's like I'm sitting here as an African-American male saying to myself, you know, where are the brethren? Why do we have the sisters always stepping up? But we have some good African-American doctors too. But I just love what you all are doing. You're right down there. I think it's off of Vanderbilt.
We're off of Baynard Boulevard.
Baynard Boulevard,
right. 21st Street.
But you said earlier, we're going to take a quick commercial break because when we come back, I really want to talk about the 19801 and 802. Seeing y'all strategically got in place for reasons.
Yes.
And I want to really talk about that. So we're going to take a quick commercial break and we'll be right back.
Join us live for our weekly worship. Every Sunday at 9 a.m. on Facebook and YouTube.
I'm doing the best I can, but I still gotta have a little Chardonnay, and I still gotta have a little this, and I gotta still sneak around. The devil is a liar. That's an excuse.
Wilmington's most exciting church.
Not today.
I'm here. You can tell me anything.
I see you. We're in this together.
Breakthroughs are happening.
Treatments are evolving.
The stats can change.
Society can change.
We can all say, not today.
Not today.
Not today.
Not today.
Not today.
If we're together, bound to be better. When we're together.
And we're back. Great conversation with Dr. Scantlebury. I'm in awe right now because, you know, when we talk about, I would rather see a sermon than hear one. That is a Dr. King's quote. This is a true living example of that. Could have go anywhere they want to go in their career. And you could probably just retire and do nothing. But they chose, I want to make sure I give back to the community who have basically poured into them as well. They may not have been, the Wilmington community because you're from Birmingham or not. You say
I'm from Barbados.
Barbados, that's where you're from. But you came and you decided to make a difference in a community that really needed it.
Yes, yes.
Before we went to the commercial break, I was getting ready to start talking a little bit about strategically, you all 19801, 19802. Y'all targeted that area. Help us to understand.
Those two zip codes, when we look at the health outcomes of the residents of Wilmington and the makeup, we found that health disparities were tremendously higher in 19802 and 19801. Mm-hmm. So when you look at even the survival for a resident in 19802 and go 2 miles up into 19803, it's a difference of 8 to 9 years.
Wow.
So that just living in that neighborhood puts you at risk because of the disparities of health, whether it's access to health care, whether it's livability. When you think about neighborhoods, how easy it is to walk around and exercise. Food insecurities. We know there's a food desert in terms of getting fresh, healthy food. So what does that lead to? More increased heart disease, more increased diabetes, high blood pressure, smoking. So your community and your neighborhood contributes significantly to the difference in your health outcomes because of access and all the things, what we call social determinants of health. Literacy, in terms of being able, and one of the things that's not listed on there is just racism as a health, as a social determinant of health, in terms of the stress you carry just by being Black, being able to pay your bills. You may not be able, is it more important for me to fill this prescription or pay my electricity or pay my rent so I don't get kicked out of my house? So those are things that drive the inequities. And so in order to bring patients to wellness, coming to see us in terms of on a scale of achieving healthy outcomes, going to the physician and clinical care, my taking care of you, contributes about 20% to your overall health. What I need to do is identify those things that are keeping you from getting there. When you miss your appointment, I want to know, okay, is it that you couldn't get here? You had childcare issues. Did you need a bus pass? Those things, you didn't get your blood drawn because for the last year, I couldn't get a ride up to get the blood work. Maybe we can do something about that, So those are the things when it comes to saying being proximal matters, because if you can easily get on a bus and get to me, as opposed to having to take 3 buses across town, or you can walk, and I can make sure that you can get to a pharmacy that's close by so you can get your medications. And I can monitor you because you trust that I'm doing the best to take care of you. So therefore, if you trust me, then perhaps I can keep you from going to the ER so many times because I can do a better job. I can help control your asthma. You can call me, and one of the things we have is a patient portal so that you can send us a message. I'm out of medication. Can you fill this? You don't have to sit on the phone, press 2, talk to someone, leave a message. Some people choose not to do that. They still prefer to call. But yes, if you're sick, you can send me a message. You can call. And so we have that portal for better communication. We have telemedicine. You can't make it in, then we can do a video chat or we can do a telephone chat to be able to see how you're doing. And those things are important to be able to say, we need for you to, we care. And that is, because we care about your outcomes. We care about your health. And what can we do to get you to wellness?
Wow. How major is trust when you're talking about physician to patient?
It's very major. And COVID opened up the door for distrust with the whole vaccine issue. I don't trust it. I don't trust how it's made. And so we came after this whole mistrust episode in terms of trying to say, we're here to try to do better. We understand that there is distrust. We know that we have in the past. We own it from that standpoint. Yes, we own that there are physicians who don't listen. There are physicians who've done not so great things in the past, but we want to make a difference. We want to be able to tell you that we're here to listen. We're going to work with you. We're going to get you. We're going to make you part of the decision maker. We're not just here to tell you what to do, but we're going to have a conversation about what's best and what role you can play in getting to better health.
Excellent. Now, if I don't have insurance, or if I don't, tell me first the type of insurances you take. And then secondly, for the person who I just don't have insurance, I work at a place where they don't offer health care. I'm willing to pay a couple dollars if I, how can you help me if I'm that person who just don't have?
Yes, we take 99% of insurance is Medicaid. I think about 40% of our population may be Medicaid. We take Medicaid. We have a lot of older patients with Medicare, so we take all those plans. I don't think that their payers differ from one to another. The commercial payers, we approved for the majority of them. The one that we still struggling with is TRICARE, and that's generally for the U.S. Armed Forces. And so we don't have too many of those, but we're working. The way they work it, you have to apply during the open window period, which is not often, and then they decide whether they're going to approve you to see their clients from that perspective. So we're still working on that. We also have a sliding fee schedule for underinsured or uninsured. We're based on their income. You will just pay a nominal fee in terms of not only income, but number of people in your household. We actually are what we call a National Health Service Corps site. So we have a very minimal fee for service, not fee for service, but a small fee for uninsured.
Can I stay there for a minute? Because a lot of my viewers, not all, but just a nice portion of them, are uninsured. Okay. I'm glad to hear that you can take care of my seniors with their type of insurance that they have. I'm glad to hear you can take care of the Medicare and the Medicaid. But then you have that group who just starting out, they off mom and dad's policy. They're working, but they just don't have the job is not offering them the health care. You talked about based on an income. See, that's what for those of you watching today, please pay attention to the language, because there's a difference between affordable service and non-affordable service. Sometimes things are based on the population's income, and this is how much you have to pay. But you're saying it's tailor-made to the person. Well, y'all compassionate care is all the way around.
Yes.
So if I'm making under a little bit of money, then my sliding scale or sliding pay would be based on that.
Yes.
Not on what everybody else is paying.
Yeah, you have the certain amount based on the property level. And so if you're 200% below the property level and you have 6 people in your household opposed to 1, you may be free. It depends on how it calculates in.
Yeah, they need to give you a call, I think. What do you think? I'm just of the opinion right now. While you have a free moment, why don't you grab a pen? Because she's getting ready to tell us, how we can give them a call, where they're located, because they're right in our community. It's just that sometimes they're hidden, not that they choose to be, but they're hidden because they're brand new. And this was birthed out of COVID. So tell us, how can we get in? First, let's do the name, the heck. I just love that catchy phrase. The heck with it, let's go and be with you all. But tell us the name again, and then how do we communicate with you all?
We are the Delaware Health Equity Coalition. We are a nonprofit medical home based in Wilmington, 19802. We are right on 2100 Baynard Boulevard, which is right on the corner of 21st Street and Baynard Boulevard. It's a very small building, and you can often miss it if you're driving by. We're a Suite A, which is on the other side. There's a Diamond Chiropractic on the lower floor, and we're on the main floor around in towards the parking lot. Yes, we're so busy seeing patients. We are the marketing team. So in between seeing patients, we're trying to get out there. We do quite a number of health fairs. Our goal is really to get out into the community, do health screenings. We actually have one coming up at our facility on September 28th. And vaccination. Our goal is to get people vaccinated, not just with COVID, but to get everyone vaccinated with the flu, encourage people to get the shingles vaccine, to get the RSV, which is now has been moved up for those over 65, and just encourage overall vaccination and healthy lifestyle. We check blood pressures, and we hope to be able to have, this is an opportunity for us to come into your church and be able to provide such services or let them know about our organization and that we are here to serve.
Yeah, to my understanding, our community service, not community, but our director of community outreach had a health program here, and I think that's how they connected with you all.
Yes, we actually had a program that was in the community center.
Yes, that's awesome, and she's been excited about making sure we get you all on, because we got to share this. We got to share this so that people will realize that there's help. You know, and it's not. It's not that, again, I gotta keep saying this because I don't want nobody to think that I'm just, saying it to say it, but they're giving us a service that they could be doing many other things in their lives. All three of them are well-established, well-noted physicians, and they are giving back to this community, and everybody can afford them. You just got to make the effort. High blood pressure, diabetes, all of those things, cancer too now, but all of those things are happening in our community. And one of the things she said that kind of troubled me is that in the 19801 and 19802, the life expectancy or how long a person lived in those communities is much shorter than in other communities. One of the reasons why is because we don't go to doctors. And I've not done all the research, and I'm not going to, but I am almost a hypochondriac because if anything goes wrong, I'm going to the doctor right away. But I also realized that I wasn't always in a position where I could do that.
Yes.
And now that we are finding people such as yourself and the other two doctors who are with you, I really hope that you all will start getting a flood of calls saying, look, I'm ready to get a real physician who cares for me. Let's talk a little bit about, and before we go to our next commercial break, another service that you all provide. Well, we understand about I want to talk about the primary care part of it. Now, you've kind of like been touching on it, but I really want to just grab it, and then on the next segment, we'll finish it off. But the primary care, if a person needs a doctor, you all offer that.
We are the doctors.
I mean, well, sometimes when you look at, many of you are specialists.
Yes.
And I think that's important for those who are part of the academic world, understand that specialists are very, very keen on their area of specialization. However, but for the general practice, you all are the ones who are still doing that as well.
Yeah. Dr. Teal is general practitioner. She sees generally 6 months up to 100. And we actually have one patient that's 101. So yeah.
Excellent.
And I am also practicing primary care now, and I focus on, because of my experience with chronic diseases as a transplant surgeon, with hypertension, diabetes, and chronic kidney disease, I tend to see that population that are older or be divided. But our goal is to get the patients into the practice, and then we can divide up the need. But just to get them in for that first visit, get them seen, get them assessed, get them referred. If we talk about cancer, getting people the cancer screen. So many of them are 50 and 60 years old and have not had a cancer screen.
And when they finally get a screening or get diagnosed, it's so far gone that there's no returning. And that's the part I'm really driving, is that now is the time to get the checks. Now is the time. I was talking to a group of brothers here at our church just last Saturday, and we were talking about prostate cancer and how it is affecting our community tremendously.
Late diagnosis.
I told them, I said, I went and got checked. I don't have time to spend time waiting until it can't be helped. I want to live a full life and I want to be healthy my life.
Right.
As opposed to being sick, dependent upon people, why not start looking into it? And you all are offering a great opportunity for people to start looking at their health and not being afraid of the boogeyman that something could be wrong. Because if something is wrong and we catch it quick enough, then we can fix it.
We can fix it. Absolutely.
Yeah. I'm going to take another quick commercial break, and when we come back, I do want to talk about some other areas of in the healthcare and the disparities that we find, and to talk about y'all 2 years old. How are things going, and is things working out?
Yes.
We'll be right back.
Local news and politics in the city of Wilmington, Delaware. The latest headlines with your host, Dr. C.T. Curry.
But they get rich, getting new cars, getting new houses, getting new opportunities, but the community is still getting nothing.
And co-host Kobe Owens.
And from that time, we have slowly seen our democracy become under attack.
Weekly episodes. Sundays at 5 p.m. The Source.
Smiles are powerful. A simple smile can light up a whole room. And for 25 years, Smile Train has been lighting up the world with smiles. And each smile marks a step towards a brighter future. As the world's largest cleft lip and palate charity, Smile Train has supported more than 2 million life-changing cleft surgeries in over 90 countries, leaving a legacy of resilience, joy, and beaming smiles for generations of children. To learn more about cleft lips and palates and how Smile Train is supporting the cleft community all over the world, please visit smiletrain.org/learn. Smile Train, lighting up the world with smiles for 25 years.
And we're back. Great conversation with Dr. Scantlebury, and I'm floored. I'm happy that finally we have a response where we could get some help. We ended the conversation earlier with a conversation I had with the brethren here, and I want to be careful not to be too loose. But one of the greatest fears I found in talking to the brethren is that they don't want a doctor giving them a rectal check, finger in the wrong areas and things of that nature. Are there other ways to check for?
Absolutely. You can have a blood test, which is a PSA, prostate-specific antigen. And so what that detects is any excretion of abnormal prostate cells that are in your bloodstream.
Okay.
It detects whether you have a tumor or mass or enlargement. Your PSA could be high also from an enlarged prostate, if you're without having a cancer. But it's important to understand that if it's abnormal, I'm going to send you to a urologist because they can better determine if your prostate is enlarged, and they'll do an MRI to see whether there's any abnormal masses within your prostate. As you get older, for many men, the prostate gets larger, so that manifests often as difficulty urinating. So if you have to struggle to get your urine out, or you feel like you're not emptying your bladder, it may be that your prostate impinges on your urethra and your urine isn't getting out properly. So the urologist will often put you on medication, or we can do that once we make sure that your PSA is normal. And the one thing that is, important, especially in the African American community, prostate cancer is often, by the time it's diagnosed, it's too late. It's very late in the stage. I won't say too late. Oftentimes looking at, now you have to have a total prostatectomy. You want to make sure that it's not traveled to other parts of your body. And the mortality or the death rate for African Americans seems to be very high, higher than for Caucasians. And I've seen many white patients who have some cancers are slow growing and they may never need any intervention, but with African Americans, it can be very aggressive. So I encourage all of you out there to just get your blood tests. If you're fearful of that finger, get a PSA. Come in, see us, get checked.
And if they're fearful of the finger, guess what? If they find something, they're going to have to still stomp out a finger in.
Right, yeah. But it's a save a life.
Yeah, and at this point, I would rather that happen than for death to be knocking within a couple of years.
Yes, absolutely.
So I think that's very, very serious. Once again, I want to make sure I tell all of you who are watching to give a call to the Delaware Health Equity Coalition. And their phone number is 302-394-6060. 302-394-6060. And set an appointment. Bring your insurance that you have. If you don't have insurance, share with them that information and how you can make sure you can start working on your health. Too often I go into hospitals and I see us there, and I'm there to visit us, and we've waited so long that the only doctor we ever see is the emergency room doctor.
Mm-hmm.
An answer is in Wilmington now. And let me tell you what the answer is. It's the DHEC group. You have to utilize their services. And if you have, and I'm going to say this, and I'm not going to put this on you, I'm going to say it. If you have, and I'll look at the camera directly, if you have a doctor and you're not comfortable with your doctor, you don't feel heard, you don't feel that they are diagnosing you appropriately, it does not harm you to go and give this group a chance. If you are a male, don't think, oh, they're all women. That's not, it's about health. It's about the compassionate care that they provide. I'm hoping that you will take the time and say, I'm going to give these people a call and see what they're all about. That's 302-394-6060. It's the DHEC group. And I'm looking forward to, matter of fact, I hope, Dr. Scantlebury, that within the next several months, we come back again and we revisit this conversation. And one of the reports I hope you are able to give us is that we begin to get way more clients, and people are being helped.
Absolutely. Because
we need to change that area code 19801 and 802 from dying so early and so quickly. And with all the shooting and things of that nature going on, we don't want people's lives to be shortened because they just didn't have access. Right. And you're making that access available to healthcare.
Yes, absolutely.
So I'll give you an opportunity now to share anything that's on your heart that you want to share with the people who may be watching us.
Well, thank you. One of the areas we didn't cover was mental and behavioral health.
Yes.
And that is such a large component of the people we see. There's a tremendous amount of stress in our community. There's a tremendous amount of mental health, depression. And you know, in the African American community, we have a stigma around mental health. People they don't want to own it because they feel like they'll get ostracized. But I tell my patients, depression and mental health is treatable. We want to help you. Don't feel like you can, folks usually say, well, you're just down a little bit. Pull yourself up by the bootstraps. It's a disease process that needs treatment just as anything else. And we're there to provide that. We have therapists on site. We identify once patients come in to be able to say, do you need help? Are you depressed? Are you having trouble feeling hopeless throughout the day? And that's very important. And about one thing I wanted to add for those who want a male, we do have a very tall male nurse practitioner. His name is Eric Gum. And he is there for those who only want to see a male, but he's there to see everyone as well. And his specialist, while he does family practice, he does his specialty where he's practiced before was in mental and behavioral health. So we also have a female therapist.
Really powerful for men.
Yes, for men, that's important. So we want to let you know that we're here because we care and because we want for you to be seen and heard. And we're here to listen. When you come into the office, we're going to treat you like you're part of our family. And we want you to have that trust in us so that we can continue to eliminate those barriers to get you to wellness.
Now, what does a first visit look like with your organization, your practice?
Generally, first visit is getting to know the patient, finding out what are their issues, what are their problems, who they've seen in the past. Have they seen a previous doctor? Were they diagnosed with any issues? Have they had lab work? Did they get checked? When was the last time, if you're 60 years old, have you had a colonoscopy? Then you have a mammogram. If you're male, have you had your PSA check? If you didn't, bang, we're going to make sure that you get some appointments to go do those things. We're going to obtain, if you've be seen other places, we're going to get your permission so we can get your records from those other places where you've been so that we can begin to address what has been done in the past and how we can close the gap with your care. So that first visit is to get to know you, get your records, see what you've had. If there's something, and oftentimes patients come with an acute problem, my knee hurts, or have an ear infection. And now they're there to the doctor, but they also want to establish care. So we're going to take care of that also by addressing that immediate need. But the goal is just to be able to obtain your records, figure out where you are on your health, on your health scale, and get you those referrals and make sure that you get on the books to get your blood work, cancer screening, and a return visit.
So when I arrive, I can walk to you, but you're going to send me places to get blood work. You're going to send me places to see a specialist. Do you have any services that will help people get to those places?
Yes, we are working on getting a phlebotomist so that we can have that blood work in-house. We do some testing. Dr. Teal does pap smears. We do check your hemoglobin A1C to make sure if you are diabetic, to see where you are on the scale. We're diagnosing a lot of prediabetes, so that helps us. We check your urine if you have issues with the urine infection. So we do have some in-house labs, but we're evolving. Our goal is, as I said, we're grant-based, so our goal is to slowly integrate these services. We want to be able to we have a case manager who is doing chronic care management. And so patients who have multiple diseases, it's really about touching base with them every month. Are you taking your medication? We have remote patient monitoring where I'm going to give you a blood pressure cuff and I can ask you to check your blood pressure, but I'm going to get the result because I want to see if I can improve your blood pressure when you're home. Are you taking your medicines on time? And so that remote patient monitoring will help us do a better job of getting patients to be involved in their own care. Because if they're knowing that we're checking, he goes, I forgot to take my blood pressure medicine. I better go do that because she's checking on me, Right. So those are systems that we're evolving to make bigger and greater as we grow.
Yeah, and it appears that you all really are staying in with the times. You're not giving them a 1950 situation that they are coming into. They're coming into the 21st century items. And all of this was birthed out of COVID.
The need was there.
Yeah.
It was just a matter of fulfilling that need and being able to say, as we move from as we close the door on one profession, say, where we go from here? And this was an opportunity that was sitting right there.
Wow.
Yes, absolutely.
Do you believe that this could be a model for others?
Absolutely. Our goal is not just, we're already being requested to come south, and our goal is going to be in Sussex and Kent County.
Okay.
We're looking at moving down to Smyrna because there's a great need there.
You mean adding an office? Or you
Yeah, adding an office. No. We're not going to leave us.
Okay.
Or we're going to expand. We think this is a model that can go beyond Delaware, but our goal is to be able to get funding. You know, as a medical practice, it's really going to take us about 3 years before seeing patients and reimbursements really help us in terms of income. So, you know, we're all underpaid, but working hard. But our goal is really to get to that point and have those. You see in that brochure, our goal is really to get to a point where we are integrated, comprehensive service. There's the medical home in the middle, but we want to have advocacy and community partnerships. We want to have workforce development. So we're having students in our office being trained, nursing students. We have MA students as they come out from their training, they need hours. So we want to train the next generation. We want to be able to have that ability to connect with those who need that, who want to train in a community that they're serving. Pharmacists and medication management, we hope to get there. Like I said, phlebotomy, getting certified. All these are steps that you need certification. You have to prove that you are able to do this in a safe manner. Even LabCorp, we're working to try to figure, can you just be in our lab? But there's certain things that we have to fulfill and meet those requirements before we can get to that point.
Well, let me just be the first to say that I think that you all are heroes. Our community need people such as yourselves. I'm very big on sharing with those who I connect with.
Mm-hmm.
If you forget the people from which you've come, you're really not worth much. And I believe that you all are just doing a yeoman's job with our community, the patients you already have.
Mm-hmm.
We've heard from some of them that they are just excited about being heard. Something as simple as that. You would think everybody would have been heard, but all too often it's like, this is the issue without even talking to the patient. And then here's all your medication, and then they end up dying of the medication and not from the illness that they may have had or may not have had. So I am very grateful. I hope you will come back and give us some updates to see. And I hope those of you who are watching us today, that you would take some time to give them a call, 302-394-6060. I did it on purpose to see if I could remember. It was just wonderful that I can remember the number because I'm so impressed with this group. But that's 302-394-6060. Give them a call. Let's give them a chance to help improve the quality of your life. That's all we're asking. It's not about making money. I mean, I appreciate the fact that they're trying to get grants so they can continue to provide many services. What we didn't talk a whole lot about, but the services are there, is the mental health, like you said. But it's important that we take care of us because at the end of the day, as I say to the congregation at East Zion Fair, people will come visit you when you're sick for a day or 2 days. After a week, they forget your name. You have to take care of you. You have to take care of you. And God has sent us. And I'm not going to give you any of my stories that I usually do when I'm preaching, but God has sent us a response to prayer. What was the prayer? Lord, help us in our health. Help us to see the need to do it. So now he has sent us these 3 women, like the 3 Hebrew boys. And I can go over many different others, Father, Son, and Holy Spirit. We can just talk about the 3 in many different ways. But he has sent us these 3 who are doing a yeoman's job, but they come with a team of people who surrounds them. Sure, their credentials is what is getting the note, but they have surrounded themselves with people who are doing a great job. And I think, Dr. Scantlebury, you did a very good job with representing the whole organization today. And I just say to you, anytime you want to come on this show, I'm going to make that stuff available. I'll make our stuff available to you. And I'm going to make sure I invite you back just so we can keep hearing some of the good things and new services you have.
Absolutely. One thing I didn't mention is that in our office, we have a service, another nonprofit called Network Connect.
Okay.
And Network Connect provides community wellness ambassadors to patients who need that service, whether they're homeless, whether they have food insecurities, smoking cessation. They would actually take you once you're assigned and to the food bank to get, or to places to get they'll give you bus passes. So they will, if someone is really in need, if they're homeless, if they're struggling, they will be assigned a community wellness ambassador who would work with them for the next 4 to 6 months.
Well, the heck is really holistic.
Yes, absolutely.
I mean, you're not serving one part of the body. Your body, soul, and mind. You're just doing a great job. This is awesome. I didn't even know about that service, so that's just awesome. We want to get more information, and as we continue to get information, we're going to make sure we share with you. Again, call them, give them a call, let them know that where you are and what you would like to do. 302-394-6060. This is going to give you an opportunity to change the trajectory of your life. We'll be right back.
As Black women, we are more likely to be diagnosed with breast cancer at younger ages. We are more likely to have cancers that are high-grade tumors. And there's also a very poorly understood higher incidence of male breast cancer in the African American community. My name is Dr. Lisa Newman. I'm Chief of Breast Surgery for Weill Cornell Medicine. I'm leader of the Multidisciplinary Breast Program for the New York Presbyterian Hospital Network, and I'm also the Medical Director for the International Center for the Study of Breast Cancer Subtypes. We do need to pay attention to social determinants of health and inadequate care. But when it comes to a diagnosis of breast cancer, race is also associated with genetic patterns related to our ancestral background. As we learn more about the genetic factors that cause these biologically aggressive tumors, this is going to be important for women around the world because it's going to lead to better prevention, better detection, and hopefully complete eradication of this disease.
As a mom, I want my kids' lives to be filled with joy and possibility, and I want that for every kid. That's why I support No Kid Hungry. They work in schools and communities to make sure every kid gets the healthy meals they need. Please join me in supporting No Kid Hungry for all kids.
Thank you.
Wow, what a good show. What a great show. I've had many shows on the Coffee with Curry, but today I'm just grateful to God that we're able to see 3 women who have decided I want to give back to the community in a very meaningful way. All too often we have been overlooked and counted out and just given stuff and told you this is the way it's going to be and just move on with your lives. I've watched funeral after funeral, people who could have averted some of the sicknesses and illnesses and then the deaths that occurred, all because they did not have proper health care or health care insurance. Now we have a group who is holistic. They are serving not just the physical body, but they're also serving some of the needs that are needed in order to keep you whole, whether it be your mental, your physical. I think you need to give them a call. And I don't often do this, but I'm going to repeat the phone number again during my closing segment, 302-394-6060. Give them a call. I know, now I didn't know Dr. Scantlebury until today, but I know Coker and others, they don't involve themselves in things that is not going to help benefit the community. It's not a scam. We need them. We need them that we may live longer and have a life that is full. And as we were closing out our show, there's even other services that they provide. If you're not sure what they provide, give them a call and ask them, this is my issue. This is what I would like to see happen or have done in my life. How can you help me? That's how you can start that conversation. 302-394-6060. Until the next time we get together, may the Lord God bless you real good.
Thank you for watching this episode of Coffee with Curry. Tune in next week, Sunday at 11 a.m.